Hello and welcome to the module MRSA Prevention and Risk Assessment for Licensed Staff, a frontline forces training presented by Superior Health Quality Alliance or Superior Health. This learning module was developed for licensed staff working in multiple healthcare settings who care for a variety of patients. The purpose of this course is to further your learning and build on your current knowledge of Methicillin-Resistant Staphylococcus aureus, MRSA. What you know and how you use that information improves the quality and safety of the patients you care for. This learning module, MRSA Prevention and Risk Assessment, is part of a series of modules exploring MRSA. You are viewing the second module of the series, which provides information for licensed staff regarding MRSA prevention and risk assessment. The first module on this topic, Methicillin-Resistant Staphylococcus aureus Basics, included information relevant for any direct care staff member. Once you have completed this learning module, you may test your knowledge and understanding of the material by completing the quiz. Upon completion of this module, you will be able to identify best practices for prevention of methicillin-resistant Staphylococcus aureus, MRSA. Describe standard precautions and transmission-based contact precautions. And identify high-risk patients or residents utilizing MRSA risk assessment tools. There are many preventative considerations with regards to the spread of MRSA. They fall within 4 different categories: general, glove-specific, gown-specific, and mask, nose, and eye protection. We will go through a few components of each next. General considerations include the use of personal protective equipment, such as gloves, gown, and/or a mask, when contact with blood and bodily fluids is anticipated. Train staff to safely remove PPE to prevent contamination of person or environment. Remove PPE before leaving the resident's room and discard in an appropriate waste container. Perform hand hygiene after PPE removal. Glove-specific considerations include wear gloves as appropriate during direct care of the resident. Limit surfaces and items touched when wearing gloves that may have become contaminated. Keep gloved hands away from the face. Remove torn or ripped gloves. Perform hand hygiene before putting on a clean pair. Change gloves and perform hand hygiene between tasks to reduce cross-contamination. Do not wash or put alcohol sanitizer on gloves. If hands are visibly dirty, wash hands with soap and water before putting on a clean pair of gloves. Gown-specific considerations include wear a gown to protect skin and clothes during procedures that are likely to generate splashes or sprays of blood or bodily fluids. Remove the gown and discard it before exiting the resident's room. Mask, nose, or eye protection considerations include wear face protection if splashes of blood or bodily fluid may occur during resident care. Safely remove and discard face protection before exiting resident's room. Please see the Centers for Disease Control and Prevention's guide to donning personal protective equipment for more information. To effectively prevent the spread of MRSA, a minimum of standard precautions is necessary. Standard precautions is an infection prevention strategy used with all residents all of the time, regardless of suspected or confirmed infection status. Standard precautions ensures that handling of blood and bodily fluids is done in a manner that protects residents, visitors, and staff. Standard precautions protects facility staff by ensuring that personal protective equipment is always available when contact with blood or bodily fluids is anticipated. Standard precautions protects residents by ensuring that contaminated hands and equipment are cleaned and/or disinfected prior to use. Use dedicated patient care equipment such as blood pressure cuffs or stethoscopes and single-use disposable items such as single-patient digital thermometers whenever possible. If common use of equipment for multiple patients is unavoidable, clean and disinfect such equipment before use on another patient. Unlike standard precautions, contact precautions are implemented when transmission of MRSA may be likely. Each long-term care facility must develop policies for MRSA management that address the appropriate use of contact precautions. MRSA management policies are based on all of the following: the facility's MRSA risk assessment and MRSA surveillance, evidence-based practice guidance, and any state regulations that apply. Examples of possible situations that will require implementation of the facility's process for contact precautions include all of the following: an active MRSA infection for the duration of signs and symptoms of the infection, MRSA colonized resident who has risk factors for transmission, such as poor hygiene, open or draining wounds, recurrent infections, or are unable to contain bodily secretions. MRSA colonized resident in specialized units, such as ventilator unit or long-term acute care unit. Resident implicated in known MRSA transmission to other residents. The Centers for Disease Control and Prevention continues to recommend placing patients colonized or infected with MRSA in private rooms and on contact precautions in inpatient acute care settings. Place patients with excessive wound drainage suggests an increased potential for extensive environmental contamination and risk of transmission on contact precautions and in a private room regardless of multi-drug resistant organisms carriage status. Examples of possible situations that may not require implementing contact precautions include known MRSA colonized resident who is able to maintain good hand hygiene and personal hygiene, resident who has history of MRSA infection successfully resolved, who is able to maintain good hand hygiene and personal hygiene, resident who has completed appropriate treatment for MRSA infection and symptoms have resolved, patient who has been screened for MRSA colonization by laboratory culture and meets facility definition for standard room placement. Some supplemental prevention strategies. Consider active surveillance testing or screening for MRSA on admission to acute care facilities. Screening could be limited to high-risk patients, such as those with prior healthcare exposure, or admission to high-risk settings, such as an intensive care unit. Those found to be colonized with MRSA should be placed in private rooms and on contact precautions. Active surveillance testing could be combined with source control strategies, as described above, for high-risk patients, such as ICU patients and those outside the ICU with CVCs or midline catheters. Cohorting can be implemented as an effective preventative tool. Again, the CDC, or the Centers for Disease Control and Prevention, continues to recommend placing patients colonized or infected with MRSA in private rooms and on contact precautions in inpatient acute care settings. Be sure to provide regular competency-based training on proper use of personal protective equipment and monitor adherence to best practices. Place patients with excessive wound drainage on contact precautions and in a private room regardless of multi-drug resistant organisms carriage status. Patients with excessive wound drainage suggests an increased potential for extensive environmental contamination and risk of transmission. MRSA risk assessment may include assessment of compliance with existing infection prevention policies and protocols, estimates of a facility's MRSA burden, such as rates of transmission and infection, and a case review of individual MRSA healthcare-associated infections. MRSA risk. Resident-specific factors. Known patient or resident risk factors include, but are not limited to, severity of illness, previous exposure to antimicrobial agents, dialysis, mechanical ventilation, repeated contact with the healthcare system, or previous colonization by an MDRO. Specific risk factors that may be related to a facility's geographic or demographic location should also be included in your facility's risk assessment. Other factors to consider when conducting a risk assessment include invasive procedures such as dialysis, the presence of invasive devices such as urinary catheters, intravenous lines, feeding tubes, mechanical ventilation, etc., and advanced age. Underlying disease conditions may increase the risk of developing MRSA. These include chronic renal disease, insulin-dependent diabetes mellitus, peripheral vascular disease, and dermatitis or skin lesions. Reporting a change in condition is an essential component of prevention and/or prompt treatment for any disease. The following changes in condition require immediate notification to a physician or other medical provider. Any symptom, sign, or apparent discomfort that is acute or sudden in onset, and a marked change such as more severe in relation to usual symptoms and signs, or unrelieved by measures already prescribed. Congratulations, you have successfully completed this module. It is now time to test your knowledge by taking the quiz. Click on the link for the Methicillin-Resistant Staphylococcus aureus MRSA Prevention and Risk Assessment quiz on the Frontline Forces page or in the YouTube description below.